It's Coronavirus and You TV program. I'm Frederick Chitangala. The big question is, does coronavirus exist? And why are we asking this question? These are the points for discussion today. I'm privileged to have, once again, the second time on this program, Dr. Sody Munsaka, who is Dean of School Health Access of the University of Zambia, and of course is also the Neuroimmune and Infectious Disease Specialist. Dr. Munsaka, welcome.
Thank you very much, Dr. Stein.
Okay, indeed. You're free to call the number you're seeing on the screen. What do you think? Does coronavirus exist? Why do you think a lot of people stopped wearing masks and observing social distancing in the area? What is going on? And why are people behaving the way they are behaving? We want to hear from you. Doc, the first question, does COVID-2 exist?
Wow, that is a very difficult question, and it really depends on the context where you are asking it from. If you ask somebody from Europe, from the US, from South America,
yeah.
it would be a very simple question to answer. But if you ask somebody who is in Africa, particularly here in Zambia at Soweto Market, they will tell you otherwise. So I think in our discussion, we'll really talk about the faces of COVID-19. And
why would somebody here in Zambia answer me otherwise?
Yeah. So basically it's because they've been looking on the media, they've seen the face of COVID, and are not seeing that here. So this is the reason why I'm answering you using the perspective of people that I talked to who are on the street. I've been moving around. People are not doing physical distancing. They are not masking up. My office is in the hospital. I see people walking around with masks dangling on necks in UTH.
There are already phone calls coming right on the program. Because this is a community program, may I text, and I hope that it's not a phone call for the previous program, but you please call back. Feel free to call back, and I'll take your call. I want to hear from you. You are through to coronavirus, and that's where you're calling from, and your name, please.
I just want to ask, how many cases?
How many cases? Yes.
How many cases? For COVID.
How many cases do you have for COVID? Okay, thank you so much. We will try to answer your question. I'll give it up to Dr. Munsaka to do it right away. Thank you for calling.
Yes.
Yes. So maybe we can give a global overview. As of today, actually, I'm live here online looking at the live numbers. So we have 12,400,000 cases.
Wow.
And 557,000 deaths. The recoveries are 7 million. And if you look at the number of daily deaths, we are actually around 6,000 deaths. Like yesterday recorded, 6,000.
Daily?
Daily. The peak was around 8,000. And last month we had reached around 5,000 deaths. But we've started creeping up, and we are now around 6,000. And it's actually going up. Yes.
And for Zambia?
So if you look at for Africa, if we let me go to just tell you the high numbers. For USA, the number of deaths yesterday was actually 960. Brazil was actually 1,000, almost 1,200.
So USA
yes.
A lot.
Yes, they've gone up. If you've seen, USA was coming down in the 500, 400. They were going down. They've gone up. I think today, the next few days, they will actually be reaching 1,000 cases. Yes, and if we come to Africa, South Africa had 118 deaths. These are the highest. Here in Zambia, the number of cases is actually 1,895. with 42 deaths. And this is the data that was already given by the Ministry of Health. So we are just going over the data here. Yes.
Okay, and okay, let's take another call. You're through to coronavirus, and you tell us where you're calling from and your name, please. You're through to coronavirus, and you tell us where you're calling us from and your name. Okay, please try to call again. It looks like somebody's still online, but we can't hear them. Have you ever seen the virus yourself in the lab?
And for a very simple reason that viruses are very small and they can only be visualized using electron microscopy. But there are indirect ways of measuring viruses. So on a daily basis, we do PCR, where we look at the genetic material. So that is an indirect but almost direct way of measuring virus. And so as scientists world over, and clinically, that is the diagnostic criteria which is there. So it's based on
Are you saying we don't have that kind of a microscope in Zambia?
We do have, there's one microscope, and they are actually, it's mainly for research purposes and not for diagnostic purposes. Yes.
Okay. Please, I've seen quite a number trying to call. Try to call again, and I hope we don't jam up the phone, but we want to really hear from you what you think and what is going on in your community. Do you think coronavirus exists? And why do you think some people right now in the community are thinking it doesn't exist? Tell us what's obtaining on the ground and what you yourself think. And also, perhaps you can have a question or two to Dr. Munsaka, who is an expert in the field. Now, Doc, we have seen a number of COVID-related BIDs on the rise here in Zambia. What is this telling us?
Okay.
What are the implications of that?
Well, the implication of this...
Okay, so let's hear more viewers. Thank you so much for calling coronavirus, and tell us your name and where you from. Yeah, through to the program, please.
Good morning, sir.
Good morning.
Good morning.
Yes, my name is Chitin Seluka.
Yeah.
Calling you from Mongo.
Please, a question or your contribution?
Yes, sir. My contribution is this. First of all, it's very interesting. The first question you asked the doctor was, does coronavirus exist? And the doc's response was, that's a very difficult question to answer. So that answer coming from a doctor is very interesting, because I was thinking he was supposed to outrightly say it does exist. Yes. So that was a very discouraging statement on my part, especially that we are trying to convince the masses that this virus does exist.
Okay.
So let me now just give a 2-minute contribution of why I feel people have confidence in the fact that coronavirus is there in Zambia. If you have noted, the updates have been very consistent. They've been very good by the Minister of Health. He's been telling us to distance. But one thing is, if you see what's happening in the compound, no one is actually distancing, and no one is actually dying of COVID. We have seen political rallies have continued in PF strongholds or in whatever strongholds, and yet the health authorities have not brought this to task.
Yeah.
So, and people are not dying. So this really brings about something interesting. On the issue of testing, you had asked the doc about testing. We have been asking ourselves why this testing has not been decentralized. Because we are able to prime the PCR machines and have test results in real time. we do not have to take them to central places like Lusaka and Dorona. So I would also want to find out why we have not taken the deliberate interest to deliberately decentralize the testing, because it is possible.
Okay.
So, yes, so those are some of my concerns. Then the last one, sir.
Yeah.
Leadership is key in everything, especially in a global emergency like Corona. We have seen what it has done to other countries. And the masses will only follow you if they have confidence in what you do. Initially, when the announcement started, everyone was interested. We should not forget that.
Yeah.
They were very interested, but how come they have fallen off? It's because they do not have confidence in what you, the health personnel, and the politicians are announcing. And they might actually die because they don't have confidence in them anymore.
Okay, Chiti, thank you so much. Thank you so much. Please, I'm not trying to be rude, but I just want to give chance to others who are trying to cope.
Okay.
Just one question for you. What is going on in Mongo right now?
Sir, in Mongo, the only thing is people are going about their daily business. We are even entering shop right now without masks.
Yeah.
Sometimes the guard will allow you, sometimes you won't.
Okay, so do you think they are doing that because they are not believing what they are seeing on TV?
Exactly, sir. There's no other way.
Okay, thank you so much. I will ask Dr. Munsaka to comment on your submission, especially on the first one, and then we can proceed. Thank you so much.
Yeah.
Thank you, doctor. Thank you, doctor.
Thank you. Yeah, thank you very much. And I think let me set the record straight so that we are clear. SARS coronavirus 2 exists. And we have seen cases globally and even here in Zambia. I was trying to answer it figuratively based on what I'm seeing on the ground.
From the community
perspective.
Yeah.
Community perspective, because I've been told even personally to say, we are not seeing this. So this is what actually was trying to say. I think he brought out an important issue on decentralization, and that has already started. Because when we started, it was UTH and UNZA doing that, but now it's Ndola. I think Liston is also coming on board, and a lot of provincial hospitals that actually have gene expert.
Yeah.
They are actually rolling out gene expert. So it will be all over the place. Yes.
Wonderful. Let's get back to the question of the rising COVID BIDs.
Yes.
And what this is telling us.
So I think it should be important for people to know that, because we don't know the extent of the COVID infection in the country, what is happening is the Ministry of Health has actually scaled the testing of even BID cases. So meaning that all the BID cases are actually tested. And this is why in the last few updates, we've seen a number of BID tested positive. And those, by case definition, are regarded as COVID cases, even if they have other underlying causes. So these would be people who are ill in the communities. And I mentioned, which is not even a joke, that if somebody got shot and they are brought in dead, they'll still be tested. And if they are found to be positive, it will still be recorded as a COVID death. So this is actually what is happening. But the implication, to answer the direct question, is that we do have a lot of infection in the community, which is not caught by the current testing. And so they are catching it at BID level. This is actually what is happening.
I wish maybe in the next update, the Minister of Health can tell us, out of the 20 or 40 or 50 bodies that were brought in dead, how many tested COVID positive?
Yes, maybe.
Instead of just telling us 14 out of 18, 14 were BIDs. We want to know how many, because now people are thinking, if the moment you die from home, straight away,
Yes,
it'll be COVID.
Yes. Yes.
Yeah. Now, Doc, other than seeing a number of COVID-related BIDs going up, we have also seen a surge in a number of new cases here in Zambia. Do you think this is due to the code, or is this due to the fact that people have stopped taking precautions?
Yeah, that's again another interesting topic because when we started the discussion, we were actually projecting that we would see a surge during the cold season, which has come out true. But then the predictions were that we would see a decline in the cases in the northern hemisphere, which also has turned out not to be true.
Absolutely.
If you look at the US, especially very hot states like Texas, Miami, they are having huge numbers. Like California, you know, they are reporting like almost 30,000, 50,000 cases. Can you imagine? Just over.
Yeah, yesterday
the week.
USA had 61,000
Yes.
new cases.
New cases, yes.
Yeah.
And the deaths are reaching almost 1,000. And they are in the summer. This is the peak of the summer. So here, I think most of the cases that we are getting are actually import cases, and then primary and secondary contacts of those import cases. So meaning that our tightening or our control measures should be the borders, because we should agree really that in terms of community transmission, it's still very limited. And once we start having that, it will really be catastrophic, because look at the communities, look at the markets. We do have, people are not actually abiding by these measures. Masking is actually completely not there. People are only masking if they are going into a mall or an regulated area where it's a requirement. And the moment they walk in there, they have to move the mask. Physical distancing, people are not observing. You can see on our buses, even our school children. I've seen whenever I'm driving to work, children don't mask up. They only mask up when they reach the school.
Yeah.
The moment they leave, they actually are not masking up. Yes.
I'm still getting back to the same question, Doc. Are we being hit on carelessness? I know it's cold, and
Yes.
we were told that we might see a surge in the number of cases when it gets cold. But also at the same time, like we have just heard from Mongo, and I believe the situation is everywhere.
Yes.
Is it really due to the fact that it's cold, or people are careless?
Well, so it's not the code, because I should, and this is a follow-up to the previous question, that the virus has evolved, because initially the adaptation was to the cold environment, but we've seen that the virus has actually adapted to even the hot, humid environments that are in the northern hemisphere now. So meaning that the question of whether now we have to actually remove it, because we've seen that the virus has actually adapted.
Yeah.
Meaning that this is just a normal cycle. So meaning that even as we go into the summer, like August, September, we may actually see a further surge, very similar to what is in the northern hemisphere, if we actually don't take these precautions, especially that airports have actually opened up the borders. We've never really closed the border, so we still have these cases that are coming through. So meaning that the border security in terms of biosecurity testing at the borders will be very, very key.
Some of the comments I'm seeing on social media right now, people are saying, look, if our own politicians are not scared of the virus, why should we? Because they're in reference to the fact that most politicians now are going about their business, conducting meetings without respecting the public health guidelines that have been given to fight COVID. And if you look at the markets right now, I don't know if my director can show us some pictures from as it happens from City Market or in Lusaka. And we have market authority. We have the means of local government.
Mm-hmm.
Is it really the borders alone Oh,
Yeah.
or we also have a role to play in what's going on.
Well, if we didn't have the virus within the country, we would say that we just intensify at border controls and biosecurity around the borders. But because we have these cases, and we also have unknown cases.
Yeah.
By the way, in terms of projections, whatever we have, you have to multiply by 10 or so to get the actual. So meaning that our cases, we probably have 10,000 people moving around without actually knowing. And some are actually recovering. Yeah. So if you see, I don't know if the picture has been flashed, but in the communities, especially markets, bus stops, all over, people selling things in the street, there are no measures that are actually being put across. And I think we are just, I don't know if it's a blessing, a special blessing that we have, that the disease has been mild here. And that's the single reason why people are not paying attention. They are ignoring that.
Okay, so you did refer to the fact that we have seen a spike of new cases everywhere. In America, in Hong Kong, in Australia. In fact, they are going into second lockdowns right now.
Yes.
Despite the fact that in most of these countries, they have just entered their summer. Yes. And their summers are hotter than our summers. Yes. What should we expect in October here in Zambia?
Yes, so definitely we should sound an alarm. In fact, let me sound an alarm that we are going to see a surge. In fact, we were thinking that the peak would be during the winter, but we are going to have another peak because we've seen that if you look at globally and in the northern hemisphere, where even I was checking on the news today, they were actually shutting down. Certain states are actually going into lockdowns. So meaning that in August, September, October, during our peak of summer, we are going to see a surge even here.
Yeah. Yes. Please will call us. We've seen so many calls trying to come in at the same time and they keep crashing. I'm sure telling each other the line you're calling is busy, but try to call in. We want to hear from you. What are your contribution and what is the situation where you are? Doc, if you look at countries like Bolivia, now they have dead bodies in the streets.
Yes.
The health care system has been overwhelmed. People are just dying from home and dump those bodies into the streets, meaning that they've transmitted the virus to the surviving family members. What can we learn from this?
Yeah. So I think our authorities and the people here need to learn from what is going on. And there's just this mystery that the virus, it's the same virus that we have, but I don't know if it's the genetic of the people or there are certain predispositions, some of them that we've written out, are making this disease to be mild and asymptomatic in our setting. Because otherwise, if we had severe disease as what we are seeing in the northern hemisphere, we were going to have a similar situation where our healthcare would have actually been overwhelmed by now. Yes.
What is so special about South Africa? That they've got the numbers more than double what China has.
Yes,
and we don't have it, and Egypt.
And Egypt, yes. So again, that is one of the scientific nightmares and some of the issues that we actually don't know. But maybe one of the issues, if you look at South Africa is very developed. It's almost like a European country. If you look at Oliver Tambo, the airport, the number of planes in a minute have about 9 planes landing at Oliver Tambo airport there. But if you look at, like here, you can be at the airport for 2 hours and no single plane lands. So I think those are some of the dynamics, because most of these cases, of course, they are actually import cases. Yes.
All right. Now, young people in Zambia are, of course, at the forefront, trying to convince everyone that coronavirus doesn't exist. I don't know if it's the youths or or disgruntled or whatever, but mostly it's young people who are against this.
Yes, yes.
I remember being in a public gathering where we were doing aerobics, and the instructor was telling us to keep a meter or more from the next person we're exercising with because of coronavirus, and the passersby just said, "You are lying, coronavirus doesn't exist." This is a young person who should be in the forefront of campaigning, preventing coronavirus. And yet, if you look at Tokyo, in Tokyo, in Japan, 75% of all new cases are people in their 20s and their 30s.
Yes.
What should we do to convince these people?
Yeah. So this is an important question because earlier on, because remember, this is a novel virus, so we actually don't know a lot of the biology of this virus and the pathophysiology. We are not very sure. So earlier evidence was showing that this virus is very pathogenic to people with certain underlying conditions. So the elderly, people with hypertension, cancers, diabetes, and things like that. But then we've been seeing small pockets of very healthy young people in their 20s and 30s that are dying, including young children, like infants also. And there are postmortem studies that have actually shown that this virus actually affects different organs, and including certain blood cells, and they are actually seeing clotting disorders that are actually, and a lot of them are the ones that are killing young people. These clotting disorders. And so a lot of studies are actually needed for us to actually understand this virus. But what should be important, and the message that should be inculcated in people, is that it affects all the age groups. So in as much as we are protecting the elderly, teenagers and the youth, they also have to take precautions.
Yeah.
Yes.
In the last update, the Minister of Health, Honorable Chitaro Chirufya, did mention that among those that will be at very high risk are those who are HIV positive, whether on treatment or not.
Yes.
We know that in Zambia, the virus suppression rate is not that impressive.
Yes.
I think just a weight to people that are living with HIV, whether they're on treatment or not, would be very important at this particular time, because they are very much at risk because of the
immunosuppression.
Yeah.
Yes. Yeah, so it is important that immunocompromised people, so people with cancers, or people who are HIV positive, those are more at risk. In fact, the projections were actually showing that because of the immunosuppression due to HIV in our setting, that we would have more severe disease. And then also those that are HIV positive, either without knowing or they are not on ART, so they are not virally suppressed, those who actually have higher morbidity, and even the mortality would actually be higher in those people.
Yeah.
Yes. So they need to take extra precautions.
That's right. What do you think about the question we have asked today? Does coronavirus exist? Why do you think people are behaving the way they are behaving in your community? We want to hear from you. Don't keep quiet, because if you have got information, it's important that somebody watching today learns from that. And who knows, we can save a life. The fact is, this is not joking matter. We need to share information and help each other. So call that number on the screen, or alternatively, find my name on Facebook, and we are going to find this live broadcast going on right now, and post your question in the comments section, and we'll be glad to have a chat with you. Doc, you have briefly referred to my next question. Pathologists have discovered that most COVID victims' bodies have blood clots in almost all body parts.
Yes, yes.
Does it mean we still don't know a lot about this virus?
Yes, it means actually that we don't know about it. So they are calling those coagulopathies, and so people are they are observing people having similar things to strokes or heart attacks, especially those that are in their 30s, 20s and 30s. It's actually very common. So meaning that this virus basically we call that there's a name, I'll mention it when it comes. Basically what happens is that the immune system responds to actually fight the virus, and in so doing there is a collateral, it's actually called collateral damage, that the immune system actually does. So it's actually the effect of the immune system on the virus, but then it affects other normal tissues and organs. And we, in our research, we've actually published a paper where we've explained that certain diseases that we have here, like malaria, especially malaria, parasitic and protozoan infections like helminths, they have conditioned our immune system in such a way that when people are infected by the virus, they don't aggressively respond, causing that collateral damage, which I've mentioned. In fact, that may actually explain the reason why the pathology is very different in our Western folks versus us here. That is probably what is explaining why we are actually having a mild infection here. Yes.
Well, all predictions that were coming by January and February suggested that Africa will be the worst hit by now. Of course, there were so many factors that could justify that: HIV, poverty, malnutrition, and healthcare system being poor, and other just health conditions that we are faced with. Why are those things not at play?
Yes, so it's because of the factor that I've actually mentioned, is that if you look at the pathology, the disease process of COVID, it looks like it's more driven by the immune system, the way the immune system is actually responding, and we call this an inflammatory reaction. So you find that because of the myriad of infectious diseases that we have here, you find that our inflammatory reaction is not that very strong or vigorous when it comes to a new infection. So the body is just treating it as just maybe just a different organism. But then our friends, our Western colleagues, who are not bombarded by a lot of these infections, whenever they have an infection, the immune system tends to have a very aggressive reaction, which actually causes this collateral immune damage.
A gentleman by the name of Humphrey Simwala from Chipata Compound here in Lusaka, thank you so much for your text message. And he says it does exist, only that very few people are being infected in Zambia, maybe due to our environment as we are used to it. Our environment, but once you are infected, that is when someone can appreciate, which is very dangerous. Do we really have to wait until we get infected for us to appreciate?
Yes, and people were actually waiting to see that, okay, how come high-profile people are not getting infected? We've seen here, even our own ministers actually coming up and announcing that they are infected, and people have recovered and they've gone on with their normal business. So what more do people need to be convinced that this virus is there? Yes.
Wow. All right.
Maybe should I tell you that there are people who still believe that HIV does not exist?
Oh, up to now?
Yes.
Right now?
Yes, yes.
I wouldn't be surprised because I've seen some write-ups, funny write-ups.
Yes, even from scientists.
Okay, maybe we can have a discussion on that one one of these days. Now, WHO, the World Health. Before we go, let me take this phone call coming. Thank you so much for calling the program. May we know your name and where you are calling from?
I wouldn't be surprised because I've seen some funny write-ups. Yes, it is from scientists. Hello? Hello?
Please proceed with your question on coronavirus and you or your contribution.
Yes, I want to discuss something with Dr. Munsaka concerning the increased number of BIDs.
Where are you calling from, madam?
I'm calling from Silverest.
Thank you.
Yes. So now, Dr. Munsaka, I want you to highlight on something, the fact that we are having an increased number of BIDs. Could it be that our symptoms are actually changing from the traditional ones we've been seeing in the Western countries? Because I'm of the idea that for the relatives to be very content with the patients at home, not taking them to the hospital, then they're not suspecting that the patients actually they have COVID-19. Thank you, sir.
Thank you.
Thank you very much for that question. In fact, I've talked to one of my pathologist colleagues that we need to write up a study and actually study this pathology, and it's actually in process so that we can actually document these symptoms and to see if there are actually differences. There's another study also that CIDers are actually starting to do to actually study the natural cause of the disease.
Yes.
And they'll be looking at the infected people and following them up so that we can actually document this. And I think as we have mentioned, this is a new disease, so there's a lot of things that we actually don't know. In the issue of BIDs, you have mentioned that if we can have an update. I don't think there's an increase in terms of the number of deaths that are brought in. We can maybe try to gather this information. But what is happening is it's just that they've started testing people that are actually been dead. And then the cases are actually being reported. And of course, the more you test, the more you find. So this is actually what is happening. It's the increased testing which is causing this.
Yes. There's a very interesting debate on our YouTube channel regarding the question we have, and you should have a look at this. I don't think it's something
I
that
should go there and check.
It's something that we need to discuss right. But most people are just saying studies need to be done by us, and we need to have leadership that is leading by example. And yes, others, it is real. We can't beat about the bush. It is real. Yeah, so very interesting, and thank you for those of you that are watching us right now. These are the contributions we are looking for, because we need to hear from you. But more so, if you still have time, please call us, and we want to hear from you before we conclude the program, as we are heading towards the end of our discussion. Now, Doc, WHO now says it's airborne. What part of our fight should we change?
All right. Yeah. So that's, again, another very interesting issue, because if you remember very well, if people watch what the minister says, the minister has actually said airborne.
From the beginning.
From the beginning.
Yeah.
And us as scientists, we've always been trying to be cautious, because we follow WHO, like I follow WHO, which was saying droplet, but that is changing to airborne. But even in our explanation for airborne...
Let me just hold your thought right there. Thank you so much for calling Coronavirus and UTV program. Tell us where you are calling from and your name.
Yes, I'm MM calling from Western Province.
Thank you.
Yes. In line with the topic for today, does corona exist?
Yes.
Something that I wanted to find out. Could it be a coincidence? In Western Province, we did not have any case before 20th of May.
Yes.
But later on, of course, I work in the health systems. Samples which were collected on the 25th of May, when they were transported to Lusaka for diagnosis for COVID, we noted that the same day we had positives in Sesheke, Senanga, Mongo, and Kaoma. But then the contact to these individuals who came out positive, up to now, there's no one whom it has been diagnosed positive. What could we say? Does COVID really exist? And even these people who were diagnosed to be positive, of course, the contact tracing would have been done, but we never saw these people being put in the quarantine center. Their results are negative. One of the individuals is a child who's 5 years old. A 5 years old stays with a mother, probably with other siblings. But all these people do not have corona. They have no history of travel. Should we say corona has always been there? We are doubting it because now we are seeing people are gathering, even those who are giving us directives that we should do social distancing, we should mask up.
Yeah.
Those people are in the forefront. They are gathering. They are not putting on masks, meaning what they are telling us is not the gospel truth because they are not implementing it. They are not afraid of corona themselves. So should we say corona exists when I know I've never traveled out of Zambia? I'm a 5-year-old person. My mother is not infected. My brothers, sisters in the neighborhood are not infected. Should we say COVID exists?
Okay, can I ask you a question before you hang up?
Sure.
You said you work in the health system, the healthcare system?
Yes.
What is the situation if you work in a hospital? What is the situation there? Are people masking up? Are people following precautions?
No. Even people who are working in the institutions are not provided the necessary PPEs. Things are normal. COVID, people are even relaxed. We don't see any sense of urgency. I mean, even people who work in the health systems, they are now even questioning this COVID. I'm one of them who are questioning it.
Thank you so much, Mr. MM. I will have the specialist yet to respond to your concerns.
Okay, sure. Thank you.
COVID is there, and for transmission, any virus to be transmitted, there are transmission dynamics. One of them is the viral load, how much viral shedding is there. And we've seen even in families where a couple is infected and their children are negative. Yeah. So for as long as they are keeping those precautions, they are hand washing and all that, the infection will actually not occur.
Thank you. Another text message from Humphrey in Chipata compound. Also, sensitization programs must be intensified, maybe door to door and in local languages so that people may see how really dangerous it is. No wonder people are not taking precautions of preventive measures. Maybe is attributing that to lack of sensitization.
Yes.
We're not doing much, are we?
Well, I think we are not doing much because I think most of the messages, of course, they are like on radio and on TV. But if you look at the people who are in the markets and all that, mainly they are not tuning up. But I think the Ministry of Information, they've done their part because I remember a month ago, I used to watch the Minister, Honorable Celia. She used to go around with microphones, with Zanis and all that. I don't know if she's still doing that, but no, I think we need to do more.
After she got infected, she may have reduced on that. But maybe some officers from the Zambia National Public Health Institute are doing that.
They need to do that. Yeah. And probably that's how she got it, because she was really out there and she did a very good job sensitizing the people. And I think we need to continue that momentum. Yes.
All right, I'm informed that I've got very few minutes remaining, less than about 5 minutes, but you can still squeeze in that phone call. If you're itching to call us or to text us, do that right now, and we will take it. Now, Doc, this is that time when we still have to repeat ourselves until we sound like parrots. What should a person do to avoid getting coronavirus?
Yeah, so coronavirus, in terms of transmission, it's transmitted by these droplets as we are coughing, even talking, and these droplets can stay in the air for a considerable period of time. This is the reason why the airborne thing is actually coming. So the way we can do this, number one, is physical distancing. The range of the water droplets is about a meter, about 6 feet, which is about 1.8 to 2 meters. Like the way we are seated here, this is the safe distance. Then secondly, issues of hand washing. where there are no hand washing facilities, sanitizing of hands would actually be very key. Then if you are in an environment where you cannot maintain safe distance, like in a bus, in a public place, in fact, like for me, in any public place, okay, for as long as I'm not in my home, I'm always in a mask. And I cover my eyes. So my whole face is actually covered. And I've really liked that because I move everywhere and I'm not recognized and all that. And I think for me, I like it. I know even people, I've seen people who say that even Van Congole, they can't see you.
Of course.
So it's a very good way of keeping up and moving in public. Yes.
You're just telling me what I should start doing now. You know, we're in a place I'm not supposed to be. Mask up. Nobody's going to recognize you.
Yes.
Yesterday, I was at Kablonga Central Mall. I masked up, of course, and packed my car, walked past APSA, and one of the people who was on the line waiting to go in the bank because the lines have come out. Will come out of the
Yes.
because they want to avoid people, too many people inside. Hey, boss started calling me. I looked at him and said, these are people who beg. So I went to where I was going, MTN, came back, and he called my name. I looked at him and said, oh, you.
This is you.
Masks. I couldn't recognize you. But you know, that's okay for as long as you stay safe from the virus. Doc, recently, about 2 weeks ago, a lot of hand sanitizers were confiscated from the market by Zamra. And the reason was that these sanitizers did not have enough alcohol content in them.
Yes.
I only remember one which is so clean. The others I can't remember their names. And so clean was very popular on the market, but only to discover that their alcohol content is not enough was very, very disturbing and disappointing. I think now they may have changed. But what should I do to know that the hand sanitizer I'm getting has got enough alcohol content?
Yeah, so importantly, it's maybe to get it from these vendors, like renowned shops. I will not mention the names because they are regulated. That's how they knew this. And then the other way is that, you can just get methylated spirit and make it at home. Like in my car, I actually have it. And then buy your own glycerin and add it if you want to moisturize.
Yeah.
That would be the safest way of going through it. But then the other way is, just hand washing. Hand washing is important because if you have soap there, you know that this is soap. So only do sanitization if that's the last resort. But then I also want to mention and also demonstrate. Let me wear a face mask here. I've seen everywhere. Today I was in the hospital. I was at cancer diseases, and I see people. This is how they wear their masks. Everyone is wearing their masks like this. I'm like, why are we doing this? Why are we doing this?
The nose is left.
Yes, and I was in a very high risk area with plenty of rooms. We were just doing CT scans, and people are like this. So this is how a mask is supposed to be worn. Okay. And then you cover your eyes.
Yes.
Okay, I'm looking in the monitor.
And now it's official. I'm seeing those eye covers in most families now. They're selling them. So when you buy a mask, also get something to cover your eyes, especially those who don't wear. Am I safe in my glasses?
Yes, the glasses. Okay. The glasses are fine.
Good.
But you see, because I don't have glasses, so I got these, and I move with these everywhere in public. That's how I move.
Perfect. Perfect. Very interesting comments from Robbie Chihululu. on YouTube. We have noted your comments, and this is why we are talking about this program. Politicians will do their own thing. Even in the US, Trump is doing his own thing. But the fact is, coronavirus is still there. You understand? Not follow what politicians, whether opposition or ruling, are doing. The fact is, coronavirus does exist. And if you follow that wind of change talking about the existence of coronavirus, want to go back to the old normal, you will be perhaps one of those people we are describing not to be not so much well-formed or not so much normal, because the truth is people who are dying in these developed countries, even in Africa, are not stupid, okay? They got the virus, maybe because somebody was stupid, gave it to them. Let's try to be human. Let's try to be, to act as human beings, because tomorrow is waiting for us to enter. We don't want to leave this world crying, you know, because we infected somebody, because we were careless. So please, take note, coronavirus does exist. If you're looking for evidence that coronavirus exists, like somebody said that, do you really have to wait until you get infected for you to have that particular evidence? No. By the time we are testing you that you are positive, you have infected your wife, your children, and everyone around you, is that what you want? No. Those of you that are in the markets right now, selling, trading, or if you are not there but you know somebody who is there, please mask up, wash your hands. We still want you to continue trading and earn that income, but mask up always. We don't want to be blamed. The same thing we used to sing 3-4 decades ago about condoms. Use condoms, you do this, abstinence. We will continue talking about these things. Even if some people are saying it doesn't exist, it exists. Wear that mask, wear those goggles, wash your hands correctly, and keep away from this person. 1.5, 1 meter to 2 meters. You can still talk. Tomorrow, you will thank me. Dr. Munsaka, thank you so much.
Thank you. Thank you this time.
This has been Coronavirus and UTV program. Has been very, very interesting today because of the interaction that we received from all of you. I hope that you will join me. Is your choice. Bye-bye.